it's Jenny D, and today's Health Tidbits with Dr. Kohli. This is something that I've been focusing on a lot in the last couple years, and I'm so glad that we were going to discuss this today. Now, of course, Dr. Kohli on 9 News, but also Cherry Creek Heart in Aurora, accepting new patients. But difficult relationships, how they age you biologically.
Oh my gosh, yes.
So, like, if you're in a difficult relationship, which, you know, I think all of us have at one point been in that, can you tell us more about how it physically ages you as well?
So this was a fascinating study, Jenny. What they did is they asked people ranging all the way from, 20 all the way to 103, average age was about 46, to say, do you have a hassler in your life?
Mm-hmm.
And a hassler was defined as somebody who creates trouble for you, who creates conflict, somebody who you're having arguments with, or somebody who makes it more difficult for you. And it was very fascinating because they looked at biological markers of aging in the saliva. So they looked to see, are you actually aging your DNA faster?
Yeah.
And what they saw was a dose-dependent relationship. So the more hasslers you had in your life, every hassler increased your biological aging by 1.5%.
Oh, no.
Right?
Okay.
And about 30% of us had one hassler, and about 10% of us had multiple hasslers in our life. So if you talk about the cumulative effect over the course of your life, you're actually causing your cells, organs, and tissues to age faster because of these difficult relationships that you have.
Well, and it's hard because, I mean, like, I'm an empath, like I'm a feeler, and, slight side of codependency. But, like, the thing about that is you have these people in your lives and you attract takers.
Yes.
So you call them hasslers, like, they're takers. Like, they're people that
They take your emotional energy.
Yes.
Yes.
And so that's physically actually, like, what are some of the things it's doing to our body besides just aging it?
So it makes you gain weight. So that having a hassler in your life is actually associated with a higher BMI. And it's not clear if it's because of substance use or because of stress eating or just because you're less active because you're dealing with this person, but it's associated with the increased BMI, increased waist-hip ratio, so more fat on our tummy as well, because that's cortisol. Those stress hormones make us hold on to fat here, and just overall poor health. Like, of course, worse sleep as well, and more substance use too. But there's a lot of mental issues too. So if they looked at the hasslers, they looked at the risk of anxiety and depression. Here again, we saw a dose-dependent relationship. So the more hasslers you have in your life, the more likely you are to have anxiety, depression, or both together.
Okay.
So it's really hard because relationships obviously are important to our healthy living. But when it comes to toxic relationships or relationships that are causing us more stress than they should, it really starts to tell on our health, our physical health, our mental health, and even our biological aging.
So who in this study was more likely to have, like, the difficult people in their lives, the hasslers?
So this was not surprising to me, women.
Yeah.
So women were less likely to have no hasslers in their life as compared to men. And I think part of it is what you alluded to, is that women try to be helpers, they try to give, and so they're more likely to have these what's called emotional vampires that suck up your energy, essentially, so to speak, but also impacting your health as well. People who had difficult childhoods were more likely to have it, and those who smoked or had substance use issues were also more likely to have these kind of hasslers in their life. If you have more friends, so if you had a larger social network, statistically, you're more likely to have a difficult friend or a relationship. So those people were also more likely to have hasslers.
And, like, I mean, they can be family members. They can be, like, it's one of those where you can't completely, I mean, I guess you could, but when you're not being able to completely cut those people out, what should we do when we have those hasslers and when we actually are able to figure that out for ourselves? Like, what's something that can maybe help us to have that less stress on us?
Well, this was really important because most commonly they were family members, in fact. And it's interesting. This was surprising to me. Less likely to be a spouse and more likely to be a parent or a child. That was a hassler in your life. And I think part of that is because you can get a divorce. You can put some distance between you and your partner, your spouse, but not necessarily between a parent and a child who you're sort of attached to more. But when it wasn't your family, it was more likely a coworker at work or a neighbor. So not people that you would classify as friends. And the reason I think this is important is, to your point, it's hard to put distance between your coworkers, between your parent, between your child, because these are people you commonly have to interact with. So you cannot control somebody else's behavior. You can control your reaction. And that's what I want people to take away from this, is that you can't necessarily run away from the hasslers in your life.
Really, you can't? I've been thinking about that a lot in the last couple of months. I'm like, I just want to run away for a little bit. Like, I don't care where, just somewhere.
You can't run away forever.
I know, unfortunately.
So, and like these are people, you take away one, you'll get another.
Yeah.
Right? It's like that whack-a-mole thing, right? You're going to whack it and you'll get another one.
You're like, well, my mom didn't call me 15 times today, but don't worry, my brother did. We're good.
So I want us to start thinking about our response and being much more attuned and aware of how we're responding to hasslers. Because even a tiny bit of stress, like if somebody, and I do this a lot because I'm always running late, somebody cuts me off in traffic for 1 second, I'll be, that's creating damage to my organs. It's aging me. So instead, you just take a deep breath and say, okay, you know what? Maybe that person is running late for something and they've got to get somewhere.
Yeah, maybe they need to get to a bathroom. That's what I was in my head. Like I'm like envisioning, I'm like, they're about to have an emergency situation. I'm going to let it go.
That's exactly right. So as much as we can, again, it's easier said than done. But I do think if we keep our eyes fixed on the prize, which is that, hey, this is affecting me on a physical level.
Yeah.
I'm going to live less longer. I'm going to die earlier because of this person and how I'm reacting to them. Is that really worth it?
Yeah.
Then I think it puts things in perspective for
And
us.
just being able to be aware of it and be, see those incidences where it's like, okay, hassler. Oh, hassler.
And labeling it.
Yeah.
I think that's really good. I mean, I think that's helpful because the label helps you to say, okay, compartmentalize, right? This person is hassling. I can feel my heart rate going up. I can feel my blood pressure. I can feel the heat coming out. So I'm going to take a step back and take a little walk or distract myself perhaps with the screen or something else.
Sorry, Mom, I'm not calling you today. I'm setting a boundary right now. But thank you so much. Dr. Kohli, of course, from Cherry Creek Heart in Aurora. You can check her out as well on 9 News. But watch out for the hasslers. I see you.